Respected chairs, distinguished guests, our panelists, all the members present here in the summit. It is my privilege to address you all in this 9th National Summit organized by Nepal Health Research Council. And I would like to thank Nepal Health Research Council for providing me this wonderful opportunity to present on our research with the topic Non-Communicable Disease Service Readiness in Nepal, a further analysis of Nepal Health Facility Survey 2021. And I would like to thank all the members, team members from HERD International who contributed and supported me for this research. Without any delay, I would like to continue and begin my presentation. Non-communicable diseases, they are the major public health issue throughout the world. And it is also a leading cause of premature mortality and disability adjusted life years in Nepal. In one hand, the burden of the NCDs, they are rising, and it is not matched with the availability of resources and appropriate healthcare response as well as the healthcare utilization. And there is a need to generate the evidence to uncover gaps in NCD service readiness to facilitate the evidence-informed policy making to improve the service availability and uptake. The major objective of this study is to assess the readiness of the health facilities in delivering the different NCD-related services like cardiovascular disease, diabetes mellitus, chronic respiratory disease, and mental health-related services in Nepal. We performed secondary data analysis from Nepal Health Facility Survey 2021. And the Nepal Health Facility Survey 2021, it was the second nationally representative survey of health facilities, and it was implemented by New Era with the technical support from ICF International. Talking about the sample size and sampling, a total of 1,633 health facilities were selected from the eligible health facilities using probability systematic sampling technique. And out of the total selected health facilities, the successfully survey was taken from the 1,576 facilities. And in our secondary data analysis, we are using the 1,487 facilities who provide NCD-related services. The independent variables involved in our study involves the characteristics of the health facilities, which include settings, ecological region, province, type of facility, presence of external supervision in past 4 months, quality assurance activity, presence of the quality assurance activities, review of client opinion, and frequency of health facility meeting. The dependent variable, it involves the readiness score. The readiness score was measured based upon the WHO Service Availability and Readiness Manual. For calculation of the readiness score for each NCD's related services, there are the tracer items tracer items that were classified into different domains. The domains include staff training and guidelines, essential equipment and supplies, medicine and commodities, and diagnostics. And the tracer items, they were coded into 0 or 1 based on the availability or functioning of those tracer items. And the score for each domain was calculated and in 100%. And average of the domain, average of all domains that are taken for calculation of the readiness score, it was the overall readiness score. And the facilities with the readiness score of more than 70, they were considered as the ready facility to provide NCD-related services. These are the list of tracer items for different NCD-related services. We use R for statistical analysis. We use QGIS for mapping, and we performed weighted descriptive analysis and inferential analysis. And in descriptive analysis, we presented mean and standard deviation for the parametric variables, whereas the median and interquartile range for non-parametric variables. And in inferential analysis, we calculated 95% confidence interval around the proportion, and univariate and multivariate logistic regression analysis were carried out, and the result of the regression analysis was presented as odds ratio and its 95% confidence interval. For this secondary analysis, we sought no ethical clearance, but the original Nepal Facility Survey 2021, it was approved by the NHRC as well as ICF International. Now let's come to the result part. Out of the total facilities offering NCD-related services, only 26% of the facilities, they have mental health-related services. And the facilities with the CVD-related services were 93.1, with the diabetes mellitus-related services were 75.8, and for chronic respiratory disease-related services, it was 99.3%. Now, this table shows the readiness score domain-wise as well as overall readiness score for each of the NCDs related services. The readiness, the median readiness score for CVD-related services, it was 35, and for diabetes mellitus, it was 35.4, and for chronic respiratory disease related services, it was 26.7, and for mental health related services, it was 18.8. Looking over the different domains, the guidelines and the staff training, it is found to be the weakest part with the score less, it is less than 20%. As we have classified those facilities with the readiness score more than 70 as ready facility to provide the NCDs related services, 3.8% of the facilities with the cardiovascular disease-related services are only ready, or they have a score greater than 70. And for the list, 2.3% of the facilities offering chronic respiratory disease-related services, they were ready. And for mental health-related services, only 3.3% they were ready. And for diabetes, it was 3.7%. Here it is a Gardner and Altman plot comparing the readiness score by province for each of the NCDs related services. And it shows substantial difference in readiness score by province for each of the NCD related services.
You have 2 minutes more.
Okay. Here this shows the facilities offering more than 70, the facilities with the readiness score of more than 70 by the type of the health facility. Among the federal or the provincial hospitals, the ready facilities, they are, the percentage ranges from 13.4 to 22.6, and among the peripheral public health facilities, the facilities that are ready, it ranged from 1.5 to 2.9% for 2.9%, and it shows that for each of the three different type of the health facilities, it is readiness, ready facilities are really very low compared to what is needed. Here this map shows the facility-wise and district-wise readiness score for different NCDs related services. Here, this table is the multivariate logistic regression model to determine the association of the health facilities offering CVD-related services with the characteristics of the health facilities. And here the facility is higher odds of having the facility to be ready was seen in the rural areas compared to urban, and in the facilities that has the provision for revision of client opinion. And it was the odds of the mountain region, they have the less likely to be ready. The facilities from mountain region, they are less likely to be ready compared to hill. And similarly, from the Madhya province, they are less likely to be ready for the CVD-related services. Here in this table, the facility with the external supervision, they are more likely to be ready to provide COPD, chronic respiratory disease-related services. And the facility with the external supervision, they are more likely to provide, they are more likely to be ready to offer the diabetes mellitus related services. And the peripheral public health facilities, they are less likely to be ready compared to the federal and the provincial hospitals. Similarly, the local hospitals, peripheral public health facilities and the private hospitals, they are less likely to be ready compared to the federal and provincial hospital in providing, providing the mental health related services. While comparing the data from Nepal Health Facility Survey 2016 and 2021, there is a substantial increase. There is an increase in readiness of each facilities to provide different three of the NCDs, that is cardiovascular disease, diabetes mellitus, and chronic respiratory disease. But mental health related information that was not collected in 2016. So there is no information. There is increase, but the increase in the readiness score for these services, it has increased, but still there is a scope to improve on them. In conclusion, the overall readiness of the facilities to provide NCDs-related services in Nepal is suboptimal, and peripheral facilities, public health facilities are less likely to be ready compared to federal and provincial hospitals, and it is essential to enhance service delivery platform and enhance the overall readiness of the health system to provide NCD-related services by increasing the number of qualified health staffs, providing training, and supplying equipments and the medicine. Thank you.
Thank you.